very warm welcome and good evening, everyone, to those and all of us who are watching us on another conversation on Chai Chat and Community by Word Palette. Today or tonight, depending on whichever part of the world you're watching us from, I'm going to discuss about abortion and women's mental health. But I have two very, very prestigious guests with me. But before I introduce to you tonight, I would just like to begin by acknowledging the traditional owners and custodians of the land on which we are meeting tonight, the people of the Kulin Nation. I also pay my respect to the elders past, present, and emerging. So on that note, to talk about and to discuss and to know more about abortion and women's mental health and various things that are around this topic, I have with me Dr. Swaroopini Thangarajah and Dr. Beulah Joseph. So ladies, thank you so much for coming with me tonight again. How are you doing?
Wonderful. With the heater on, so all good.
Thank you for giving us the time. But we'll start with introducing yourselves to our guests first. So Swaroopini, why don't you tell us and our listeners a bit about what you do?
Oh, sure. So I'm a GP obstetrician, so I work in a few public hospitals doing some maternity clinics, and then work in some private hospitals assisting with some gynecological surgeries. So a lot of women's health-based services, and then work in a women's health clinic and also do some teaching for some universities as well. So a little bit of a few things, but women's health is one of my focus topics. So this is a good chance to share a few things that I've along the way working in the field as well.
Thank you, Swaroopini. And over to you, Beulah. Please tell us something about you. What do you do?
So I'm a psychologist. I have been one for maybe about 12, 13 years now. I've worked in lots of different areas, so in private organisations in the wellbeing space, workplace wellbeing, and I've also recently shifted into private practice. I also have an area of interest in women's health, and I see a lot of women for therapy, presenting with a whole lot of presenting with a lot of different sorts of issues. So things like, motherhood, parenting, work-life balance, relationships, a lot of women from South Asian, Southeast Asian communities as well. And I do some work with universities and supervise other psychologists and provisional psychologists as well.
That's awesome. Thank you again for both of you for joining us. All right, let's start with the first things first, basically. I want to know from both of you, what makes an abortion safe or unsafe? Beulah, I'll start with you first, and Swaroopini, then I'll come to you.
So from a mental health perspective, I think there's been a lot of stigma associated with abortion. And so it can be something that's a lot of people feel guilt and shame. And that can make it very difficult for people to talk openly about even considering having an abortion. And that creates a lot of stress and anxiety for an individual. And it's a big enough decision to make to decide to go through with an abortion. But the stigma associated with that can really add so many additional barriers for someone accessing correct, accurate information and also getting the right supports in place. So, what I think we're all hoping via this platform is to perhaps present some information about abortions, what it's about, what things to think about as well, to consider from a psychological perspective. It's very difficult for a woman when you're considering an abortion, not just because of the decision making going around that, but you also have all the physiological effects of being pregnant. You're also juggling then communication with your partner, if there is a partner. You're considering then, do I disclose to my family so I can access support? But also then there's that fear of, well, what do other people think? What are they going to say if I even said the word abortion? So it's a really challenging situation for a woman to be in.
Absolutely, I agree. Swaroopini, I'd like to know from you, what makes an abortion safe or unsafe?
Yeah, I think a lot of what Beulah said is very important because, first of all, there's many reasons why someone may consider or even go through with the abortion. Sometimes it's financial reasons. Sometimes it's just not the right time for them. They might have a really young little baby and they just can't handle having another one at that time. Sometimes it's they really were. It's not the lifetime for that stage. and it's something they might not have been contemplating. So often it is unfortunately unplanned, and that's why today we'll also go through a little bit about how to potentially try and avoid having people having multiple abortions, first of all, but also trying to stop them happening in the first place if we can avoid them, because there are some preventative measures that we can do, but obviously we'll address how to manage an abortion if someone's going to go ahead with that. So basically, in terms of the safety and safety part of it, I think making sure that you are doing it in a safe environment with a medical professional is very important, because trying to go about doing it yourself, or trying to insert things internally, or trying to do it and then could potentially lead to catastrophic bleeding or complications like infections and things that could then later affect your even ability to have children in the future if you did want them. So I think making sure you do that with a professional. And the good thing about most of the countries that we're living in is that there's still going to be a certain proportion of specialists or medical practitioners that are going to be able to support you on this journey, no matter where you live. So there's, it's one of those things where we're lucky in Victoria, especially, that we have laws to basically legalize it, and we're not going against the law by being able to give medications or do surgery to terminate a pregnancy. So, we can make it as safe as possible, and we make sure that we follow up those patients, which is why we have very good outcomes in Australia for abortions and terminations of pregnancies, and how we go about them to avoid complications. So I think making sure safety is there with the professionals is very important. And we'll go through and we'll give Chris a nice list of resources and how to access services, because I think a lot of things that people want to know is how do they find out about these things as well.
Absolutely.
So we'll go through a little bit of that as well.
Yeah, I agree, Swaroopini. Having the access to correct resources, I think, in these cases is of primary importance, because there are many people who have just come into the country, they don't know where to go, but we'll come into that later. But we've been talking about safety, right? So in this process, how do we ensure that more women can avail post-abortion care in the most safest way possible? So Swaroopini, this time I'll start with you, and then I'll come to you later.
Yes, so I also just want to clarify that abortion is different to the miscarriage. So abortion is the termination of the pregnancy, either by medications or by surgery. So there's those two options. So to avail that safe care, there are special women's health clinics that support abortions, and a lot of actually GPs have extra qualifications to be able to prescribe termination of pregnancy medications below 9 weeks of pregnancy. So the law allows the GPs to do that if they've got extra training in that. So sometimes you might even be able to ask your GP. They may not advertise that they do it, but they might do it themselves, or they might know one of their colleagues. So that would be the best first place to start. And then we'll give some resources about some women's health clinics that are available, and basically to be able to make it safe. In Australia, a lot of the public hospitals don't do surgeries for terminations of pregnancy, purely because they have to manage everyone's pregnancies, the miscarriages, and the gynecological concerns as well for patients. So we just don't have the resources to be able to do the termination of pregnancy. It's not because we don't want to do it. So it's just that the services just don't exist. So a lot of them have to become then go into the private sector. So that's where, like you said, Chris, the finances sort of side of it, or for overseas visitors, obviously the overseas health cover does cover certain parts of either the consultations, the medications, or the surgery. So wherever you are going to go and get these services, it's important that you check with your private health fund and ask those medical services to check how much money are you going to get back, because sometimes otherwise it can be a very costly venture as well. So they can range from, about $300 to about $1,000. So it's not something that is light in terms of financial burden as well. So something to really think about when trying to choose where you want to do it as well. And also in that sense, some places do them via telehealth, by doing consulting and then prescribing. But some people might find that that's a bit not as managed potentially as someone coming in person to check up on someone's mental health and to make sure that we've got that post follow-up as well. But some services have got a very good service in place to be able to facilitate that too. So that's something that could be an option for some women that potentially live further away from medical services, or that feel a bit of that discomfort in going and seeing someone in person as well. So there are facilities available where we can, we really do try and support women on this journey, because it's not the easiest decision, like Beulah said. Whenever someone decides to do this, it's always not something that someone was planning to do. So it's something that's, usually sudden, and they don't get very much time to then decide what they'd like to do about the pregnancy as well. So medications are safe until 9 weeks of pregnancy by the law as well, and that's determined by potentially a combination of the ultrasound, checking how big the fetus is as well, and also correlating with the day of your the first day you had your last period, where the bleeding started. That's sort of what we count from as well. So those are those two things that are important information to also give your practitioners as well. And that's where, if you think you've missed a period, then please go and do a pregnancy test, and then you can decide with your your support people and also your health professionals about what you'd like to do for that pregnancy. So there are sort of options available as well.
Yeah. Now, we had a question. I think you've already answered that, Swaroopini, that how safe is medication to terminate a pregnancy? I think you've just answered that it is safe up to 9 weeks of pregnancy.
That's right. And also it's safe in Australia because generally we have follow-up protocols in place, and it's not just that we just give the medications and leave women on their way. We make sure we follow up with blood tests and with checkup calls, and also have the facilities to be able to come back and discuss whether they've, and with the success rates in Australia for medications are actually quite good. It's about 90 to 95% effective to completely expel the fetus and the pregnancy. So again, we have to be careful. It's not 100%. Nothing's 100% generally in medicine. So even the surgery has about a 98% success rate. There's still always chance that something can still get left behind. So that's why that follow-up care with a medical professional is very important, to make sure it's safe and when it's finished and everything's complete, so that if you want to, try for a pregnancy later on, we know that we're not having something still left there from a previous pregnancy that can cause some problems as well. So that's why, again, the safety aspect is the follow-up as well.
Yeah. Now, those are very vital points for me. Thank you on that. Beulah, I'll come to you. Do you have anything else to add on how should women be availing post-ovarian self-care?
I think just to add to what's already been said, I think in terms of the follow-up care, what can often get missed is the psychological support. And it's something to consider. When someone makes a decision to have an abortion, it can be quite sudden, and so there's not a lot of time to think. There's not a whole lot of time to organize things, and then after that, of course, there's a lot of physical symptoms that you're keeping an eye out for, and so the psychological support or psychological care can be forgotten. However, lots of these programs and services do also offer that psychological support. So if you're in that position, it's worthwhile asking about what sorts of services are available. There's, of course, private practice psychologists who can offer that support. And I do see quite a few women who go through, whether it's a miscarriage or an abortion as well, are seeking that regular support so that they have a safe place to actually talk through how they're feeling. Because what can be problematic is the woman going through all of this has so many things to deal with and other people's perspectives and opinions that it can be really difficult for the woman to actually have a safe space to work through her own reactions to things, grief for the lost pregnancy, even if that's not something that you wanted in the first place. There can be a lot of sadness, there can be frustration, there can be fear. So to be able to work through some of that as part of that follow-up care is just as important. So it's just worthwhile considering as well to make sure you've got that support in place.
Absolutely. You guys have talked about support, and this can be a very quick decision. You don't have time. So I now want to bring the conversation towards the men in these women's life, right? So I have two questions. So I am trying to club them together. So I'll try to be slow so that you have an idea of what I'm asking. The first is, how important is it for the women to take precautions when men don't want to? Right? We often have heard that men don't want to take precautions. Let's be very honest with that. So how safe is and how important is it for women to take up precautions? And the other conversation that I want to ask from you is, how do we ensure that we have more men on the table discussing and addressing the issues around abortion? Beulah, I'll start with you first. So my two questions are, how important is it for the women to take precautions? And how do we get our men to be on the table and address the elephant in the room?
Again, I think it's a two-step answer to that. I think firstly, we need to keep in mind that in this day and age, women have rights, we have
Mm.
responsibilities, and we can make our own decisions. And so it's okay for us to then think about whether we need to take some additional contraception or whatever that might be. If you're in a situation where the male is not agreeable, but becoming pregnant or dealing with that, it's not an easy situation. And you might have this in a domestic violence type situation where there
Yeah.
might be sexual assault, sexual abuse there. Um, and so, for each woman, we need to own our bodies. This is our body. We have a choice, we have rights, and we need to protect that as much as we can. Sometimes we need to access supports to be able to protect that, and that's okay too. But we have a role to play in it. We can make decisions for ourselves, and we can be empowered to make those decisions, even if we're sort of facing resistance or disagreement.
Mm.
Um, I think, in terms of including men as part of this conversation, it's about moving our perception of a relationship, a healthy relationship, to one where both parties are coming to the table to have a discussion about
Yeah.
things. So it's not an imbalance of power necessarily. It's more of an open, honest conversation about where are we in our relationship? What are we looking for in our relationship? Now we have a situation where we're pregnant. We may or may not be able to have this pregnancy. Let's have a conversation about what our options are. So I think including men as part of that conversation, it's important wherever possible. Not always possible, depending on the dynamics of the relationship, but it's
Yeah.
certainly something that we need to be thinking and talking a lot more about. It doesn't always have to be women's business anymore.
Mm.
We can include men, especially the man that we're in a relationship with, as part of these important decisions.
Absolutely. Absolutely, Beulah. Swaroopini, your views on this two questions. How important is it for women to take precautions, and how do we get the men to be on the table and talk about it?
Yeah, I think Beulah pointed out very well that that autonomy that we all have to make a decision for ourselves. So, being the women and the person that's going to either decide what happens to their body in terms of a medication being given or a surgery happening, that's going to happen to the woman. That's not
Yeah.
happening to the man. Okay, so I think we have to be aware that that woman has to make that choice. But of course, we know that in the South Asian background, Southeast Asians, there is a lot of that power imbalance, and sometimes the women are being forced to make decisions. But then at the end of the day, the man and the woman, they still have 50% in the part of making a fetus or a baby. So they've
Yeah.
still got it, the women can choose 50% to protect themselves from getting pregnant. The man can do things to protect themselves too. So I think that's where, like we all said, it's about a conversation, because really if it's not a wanted pregnancy, we're going to leave sort of sexual assault, I think, aside for this. Just when I'm talking about this is more about, when the woman can choose what's happening. If you're going to have a chat about, okay, you're going to be starting to have sex, or you've already started to have sex in a relationship, then it's going to be a chat about, okay, if we got pregnant, what are we going to do about this pregnancy? Talk about it before you even get to that stage, because I'm going to talk about that we can manage abortion, so we can do that. But let's try and take a step back and go, okay, before we get to that point, the woman also has to have some responsibility for that that abortion that might happen in the future, because they've chosen to then not protect themselves too. So we've got to take a bit of a, I'm not trying to be the sort of the nasty person sort of saying, oh, it's anybody's fault. It's not about that. It's really about that 50% that you can take responsibility, and you can choose, okay, you can talk to your partner, or you can either take the measures without your partner even knowing. So that's where you've got to decide what sort of relationship is healthy, and you've got to be able to live with your decision as well, whether you
Yeah.
get pregnant and then you're being then forced to have an abortion against your will. So I think if you can decide that, okay, you can protect yourself by taking either medications or having procedures that are, that are reversible, that you can then have children when you want to, but then you won't get pregnant when you don't want, then that's a way that we can manage that, so that you can take care of your own body and what happens to you. as much as we can within the realms of science. Nothing's, again, 100%. Unfortunately, some people can still get pregnant after taking all the precautions possible. But, to the majority, we're able to then prevent those things from happening. So I think that's where later we'll talk about contraception, because that's the really big one, how to prevent an unwanted pregnancy. So I think for the woman, once we get to the stage where you have to then decide what you want to do, I think that's where again, that chat with your partner or support person or whoever you're in a relationship, if it's, that's where you've got to decide, okay, are you going to continue a pregnancy if you were to get pregnant? Have that chat earlier on rather than getting to the time. And then if you're both on the same page about going, well, we're not going to be ready to have kids for another 2-3 years, then you go, okay, well, what are we going to do about it? Are we going to use condoms every time? Are we going to have some devices or some contraceptive implants or some medications given to the woman to prevent a pregnancy? And this is where it is a little bit difficult, because the men don't get as many choices as the women get. Women can have up to almost about 10 choices of different methods to prevent pregnancies, whereas the men have the sterilization, but unfortunately then that becomes permanent, that they can't then have children. So that may not be possible for a lot of relationships where you're thinking about having kids in 2 or 3 years' time. So I think if people have completed their family, they've had 5, 10, 3, 4 kids, however many kids you want to have, once you've completed the family, yes, the men can then be considered to then have a contraceptive sort of discussion about a vasectomy to then have a permanent stoppage of ability to have kids. But most of the time, unfortunately, it seems almost like the men are just like not included because of the fact that they don't get as many options. But then we've got the condoms, obviously, and that's a responsibility of both men and women, because it prevents infections as well. If you're in a stable relationship, not as appropriate to, it's not something that, you might not think about. But if you have got, multiple partners, or you're not in a stable relationship, then you also, as women, we have to protect ourselves and say, hey, men, if you want to have sex with me, you've got to wear a condom, because I'm not just preventing pregnancy, I'm preventing infection as well. So again, the women, we have the choice to, again, setting aside rape and sexual assault and unwanted sexual behaviors, but I'm talking about those, times when the women can get the choice. Again, we can say, you know what, sorry, I'm not going to have sex with you unless you do what I want you to do, because you're putting something inside my body, and if I get pregnant, well, I'm the one that has to have the baby. So that's where I think that discussion, ideally having as early as you can. But if you get to the time when you get to that first abortion time, or that time when you're talking about this, then we can manage that from a medical professional perspective. And another major thing to think about is not all doctors are happy to provide advice about terminations of pregnancy, because they may have their own ethics or their own beliefs, or they may have their own attitudes towards this, and their own personal experience. So if you find a medical practitioner that doesn't do it, make sure you ask them, well, do you know someone else that does? Because it's your legal right to be able to get a medical practitioner to tell you where you can safely avail these services. That's very important. And if your doctor does not tell you where you can go safely, please report them to the Australian Health and Regulations Practitioners Authority, because they will get reprimanded for not giving you the medical advice, because it doesn't matter what our personal advice is, okay? It doesn't matter what I think I would do if I was going to have an abortion or anything like that. That's not on me. I'm a doctor. My advice is professional to give to. I might give you my personal advice if I feel like it, or if, that's up to every person to do as their own. But as a professional medical experts, we have to give the advice, and we have to make sure we provide the safe environment that Chris and Dr. Beulah were saying that is so vital, is that we provide that safe environment. So we've got to make sure that, if you don't find the right doctors, you've got to make sure you find the right ones that will support you through this as well. So again, those same doctors with contraception will also have their own advice and their own opinions and things like that. So again, if you're not finding what you need, please go and find another doctor that will help you through your journey.
I will bring up the conversation around faith and beliefs and how is it connected with abortion. But we have a question before that. For South Asian women who don't understand their rights, what would you say to them? Beulah, I'll come to you first, and then I'll hop on to you, Swaroopini, later.
Read as much as you can. Talk to people, and find out. Just it doesn't have to be very direct questions, and it can be just learning about how other people live their lives, how other cultures live their lives, just to get some additional ideas about how life can be. Um, and again, in our modern Australian society, women have a lot more rights than in other countries. Um, and so I think just connecting with that discourse, connecting with other women as well is really important, and just to get an idea, because sometimes I think we can be quite overwhelmed by our own lives and our own family expectations and all of that. It can be hard to take a step out. So I think as much as you can to broaden, listen to podcasts, read, speak to other people, and try to get as much information as you possibly can. I think that's really important.
Absolutely. Thanks, Beulah, on that. Swaroopini, any thoughts on that question?
Yeah, some great tips, Dr. Beulah. So I think that's really important, because I think all of us generally, we get to learn what we're exposed to in our lives. So that would be our family and our friends. So we may not be exposed to as many other things in the community that are surrounding. And especially if you're new to the country, then you're going to have the views from where you come from, and they can be very different to the Australian sort of way of life as well. So I think then again, talking with people that have already assimilated here and been here for a lot longer, and talking to them about how a safe relationship is and how the respect can be there. And again, it's not perfect even for people that have lived in Australia for all their lives too. There's still, that I think there's no prejudice about where you've come from. There are still
Yeah.
always relationship issues that can be there in any culture or any ethnicity. So being aware that, that we've got to take care of our own bodies. We're the only ones that can do that. And it's one of those things where we see it very difficult with our friends and family or our patients, where people have to take a stance for themselves to then stand up against their community, or stand up against the views of their religious faith, or against the views of their own parents or families, and kind of say, I'm doing this for myself. So it's a different way to think, but we also are in a very different generation to our grandparents and forefathers before that, where life is very different to what it used to be. And like Dr. Beulah emphasised on, is the rights of women. We've got those now. So we should be able to voice them, and we should be able to stand up for ourselves, because if we don't do it, well, we can't expect anyone else to do it for us.
Exactly.
So
And I think
that's
forums like this are really important as well, because the very fact that we're talking about the fact that women have rights and that our body is our own, that could be completely new information to someone listening in at this point in time. So having these sorts of discussions are really important for us to get the message across that it is our body. As we discussed earlier, the pregnancy, the abortion, it happens to us. So, we can have a say in what happens to our bodies, and we can start to learn how to own that knowledge. So
Yeah.
we make decisions that are going to be best for us, not best for partner, family, friends, society, community,
Totally
because it
agree.
needs to be a better balance with that.
Mm, mm. But you guys have mentioned earlier that we need to talk, right? We need to talk to our friends and family. But now I want to raise the issue of separating facts from myth, or separating facts from actual knowledge. So, how safe is it, do you think, if I'm talking to my community instead of speaking with my GP? How do I separate from what is a myth and what is a fact? Beulah, I'll start with you first, and Swaroopini, I'll come to you later.
I think it depends on who's in your community and where that information is coming from. So, being critical, I think, with any kind of opinion or information that we're given is important. Even if your GP says something for you, it doesn't mean that that's absolute truth. Have a think about it. See how it feels for you. Do you agree with this? Do you need more information for you to make a better decision, and then ask questions to get that information. So it's okay to actually think about things rather than just accepting them as absolute truth.
Yeah.
And I think cultivating that kind of critical thinking is really important in helping you work out, okay, well, this person's saying this, where's the basis for that, where's the evidence for that, where's that information coming from? So asking those kinds of questions, I think, will help narrow that down, so that you are focusing on accurate information rather than hearsay or anecdotal information.
True, true. Swaroopini, do you have anything else to add on that, whatever Beulah said?
No, I think that was a great summary, and I think that's where the places that you get information from. Some places we're going to give you some really great resources that have potentially valid medical information that we have research behind. So we'll be sending those to everyone tonight as well. And I think just making sure that, again, like Dr. Beulah said, even I'm a doctor, I'm a specialist in the field, but I don't know everything. So, it's one of those things where if you have a question, you've got to ask us. And if I don't have an answer, either I'll find it or I'll send it to someone else that knows the answer. So it's one of those things where it's you making the decision. You have to be comfortable with your decision. So you need to be comfortable with the information that you've got. Everyone processes information very differently. So we can say the same thing to two people and they can hear it very differently according to what they want to hear or what someone else might have told them previously. And it is sometimes good to talk to people that have gone through the journey before. If you do have experience with someone that said, hey, I've had a termination of pregnancy a couple of years ago, this is how it went. Well, that can help you kind of make a decision with someone telling you, oh, yep, how did it all go? Yep, it went well, great. I'll go and seek that path. Or if it didn't, then you'll know what you need to ask to make sure that maybe doesn't happen to you, or we can make that as safe as we can. So I think getting the information both ways kind of works, because even when we give medical advice, sometimes we're giving our personal experiences from things that have happened to our patients before. So we're already bringing that as part of our evidence of, hey, we've seen this work for this many people. This is the percentage that it's worked for in my patient group. This is what I'm offering for you. So, I think it's a give and take between both things. But sometimes in these type of things, we may need a little bit of the medical advice as well as the personal. Like, I don't think you can just do it from the personal advice from your friends and family, because we do need, the laws around medical terminations of pregnancies or abortions to come in. There's laws around that, about the timings that you're allowed to have the medicine for. So again, up to 9 weeks. And then also the laws around surgeries and around which hospital you're allowed to go to get this done safely. So, we have to bring those practical aspects in when we give the information too. So that's why you might want to, seek the information of the medical professionals as well. And we'll send you all those information. Yeah.
And the other thing too is that we're all very different. And so what might have worked for one person might not work for you. And so it's worthwhile thinking through the information, but also reflecting on, well, how does this fit for me? Is this something that, I think is going to work for me? Do I have questions around it? As we mentioned before, even if a doctor says, okay, you need to do this, have a think about it. How do I feel about it? Because this is a big decision. Once you make a decision to abort, you can't change your mind once it's happened already. It's a fairly final decision that you can't rewind. So you want to make sure that you have as much of the information as you can, and to also see how that feels for you, and which path you end up choosing. So that's really important to sort of work through for yourself.
This is a conversation that has to be had on a regular basis. Like, we cannot have a one-off conversation, and as you guys rightfully mentioned. But before we draw the line here, there's one thing that I really want to know from you, and before Dr. Swaroopini also mentioned, sometimes faith comes into the discussion, religious beliefs come into the discussion, right? So what role do these beliefs, or does our faith, play in safe abortions where the mother's health may be at risk? Swaroopini, I'll start with you first, and I'll come to you.
It's a really tough one, because when we really dig deep into a lot of the faiths, and I'm not I identify with the religion, but I'm, as a medical practitioner, it's not something that comes to the advice that I give. But I think when we actually go down to the basis of a lot of religions, most of them are against abortion, to be honest. Most of the big ones, they're just like, no, it's life. Life has to go on. No terminating of life unless it's going to be a risk for the mother's medical health. And again, that's only in some religions. Some of them are saying, nope, if if mother is healthy, and if baby is healthy, they have to continue. But even if the mother is unhealthy, still have to continue with the pregnancy, even though it might kill the mother for that pregnancy condition if they have something dangerous. So religion, again, we're talking about, we live in the current world today. We don't live where the scriptures were written, millions of years ago or hundreds of thousands of years ago. We are living in the world today. Everything we do is different. I think most people would not be able to live doing what the religion said they should do. And it's not something that everyone works to 100%, because I just don't think there's many people that live in the world currently that are, functioning, that live with the directions of their religion to 100%. I think
Yeah.
we can nitpick almost every person, even that's a faith leader, and find something that they've done that's potentially against their religion, like
Yeah.
in this day and world, because they've interpreted the scriptures differently for their own purpose.
Exactly.
So I think
Yeah.
we sort of have to, again, take responsibility for our body. We've got to live with the decisions we make for our life. So if we're going to, if we've got a partner or a support person or a family, and we're like, okay, this pregnancy is not going to fit with us being a good enough mother to this fetus and baby, that we're not going to be able to optimally care and bring up this baby to be, 100% of our attention is to this baby, and it's not healthy for the mother's mental health or physical health or relationship for the current situation that they're in, well, then the decision becomes easy that the pregnancy just has to stop, because otherwise the other things that could be following are just detrimental for the
Yeah.
patient's, for the woman's mental health or physical health, or that sort of the mind that they will keep thinking they shouldn't have had this child, and that they regret towards that child in the future, saying that, oh, I didn't have enough money to make for this baby, or I didn't have the housing situation I wanted for this baby. This is not the way I wanted to bring up my baby. That regret is deep-seated, and that will go on to the child in the future. And that affects so many more people than just the woman themselves. So I think, making the decision for everyone's decision is for a different reason. That's why as medical practitioners, we don't judge. We don't ask you. We ask you why, so that we make sure that, first of all, you're not being forced, or first of all, you understand why you're doing it. But we're not asking why because we're being judgmental and going, oh, well, then you shouldn't have had sex. Like, why did you do that? We're not going to ask those type of things, because at the moment you're in this situation, you're asking for our help, and we want to help you towards the end goal that you want. And if that's to stop the pregnancy, then that's okay. And I don't think religion really has a right to play in this, because the religion is not your body. Your body is where you are right now. I believe in my religion, but it's one of those things where, I don't live my life to the T with that, because it's not possible. So it's one of those things where I think you have to decide, first of all, what do you want to do with your life and your living being right now? And if that's not the best decision for you to continue a pregnancy, well, then the decision then to me is very easy. If you want to stop the pregnancy, you've made your decision, then we just find ways to support you around that. And that's why having that chat with your partner is very important, or your support person, because at the end of the day, it affects you both together, or your wider families together, and things like that. So if it's not wanted, and to be honest, if you have a termination of pregnancy and your parents are not going to agree, or your uncles or aunties or your extended family's not going to agree, don't tell them. They do not need to know. Like, it's none of their business. It's your body. Again, you're allowed to do whatever you want. You don't have to tell them. If they live with you and you need us to, facilitate that, we find a different reason to tell your parents and say, this is why you were in hospital, or this is why we did this, we're able to do things as safely as we can, again, within the legal realm of not lying, but we can find ways without disclosing why you had something or why you had a procedure done. So we are never going to tell, even if you don't want to tell your people that live in your house, we don't have to tell them that that's what you did. It's none of their business, and it's not even their legal right to know that. Again, it's your body. You've got to decide what you want to do for yourself. And the medical practitioners and the people that do help with these terminations of pregnancies, we all understand that. And again, it doesn't matter what I believe or what I think or what I would do. It's our professional advice to help you through that journey.
Yeah.
And if we do these things in our work, then that's just what we do. So I think there's no don't feel shy in asking for help. And if you don't even if you're not sure if you want to continue or not, I think even having a chat to ask about the options, you can go and do that without having a fear that you're going to be judged. I think you can then still go and have that chat. Go, and even if you don't want to, go with your support person, because then you can both decide together. And I think that's where bringing the partner is important, is into the decision making, if it's possible. If you're being forced, well, then there's no point bringing them to the discussion, because it's not helpful. But I think if it's something that you both know that that's not what you want, well, bring them to the conversation, so that then after that they'll realize how important it is to use contraception, so that you don't get pregnant in the future. And they realize what you've had to physically potentially go through with your body, because they did not wear a condom, or they didn't take responsibility to ask you, are you protecting yourself? And
Yeah.
then they will feel guilt, because actually the 50% of the guilt is also for them, even if the woman feels guilt or not. It's just the way that the grief process works. But when you've lost potentially a child or a fetus. So the blame is also with the partner too. So bringing them into the conversation helps them to understand the seriousness. And I've seen that when they've come into the conversation at the early stages, they have been so upset with what the woman has had to go through that they've never come back for those type of procedures in their life again until they're ready to either have a child or they just have used contraception, because they understand the sacrifices and the woman's body that had to go through significant hardship, whether it be the hormones emotionally or whether it be physical changes, whether it be the nausea that's been, so uncomfortable, or the vomiting, the physical changes. The partner has caused that 50% because they have, 50% of their genes inside that fetus. So they've caused that. So I think, bringing them in early makes them sort of, and that's another way to bring them to the conversation about talking about contraception, because that's already a hard thing to talk about generally with men. So bringing them in early for this is actually a great segue to set up the rest of your life, so that you are really going to only have your baby when you want your baby, if you want your baby in the future.
Thanks.
Just going back to religion, I just wanted to say that I think we can get quite distracted sometimes by overt expressions of piety and religion. And how we appear within a community, within society, in front of our family and friends. But religion is also a very personal thing. It's your relationship with your God, your goddess, your deity, whatever that might be. So it's also worth thinking about for yourself, well, what do I believe? How do I believe? What kind of life do I want to live as a person of religion? How does this fit in? The question of pregnancy or abortion. How does this fit in with my beliefs as well? So I think it's worth having a bit of space to work through some of those questions, because it is something that is personal just as much as is an expression to the rest of the world of what your beliefs are. So it's important, I think, to set aside some space. It also can be difficult, the traditional kind of dogma of religion versus our modern day life. That's a real paradox sometimes. So, I don't think any of the institutionalized religions have worked out a clear way. So if you're struggling with that, it's okay. But you need to work out a way that's going to fit for you. And that's the important part, I think.
Yeah, I agree. I agree with both of you, because I think sometimes we take it a bit too much, and that's where some issues arise. But moving on, and I think we'll take this as the last question. So Saleh asked, till how many months or weeks is it safe to have an abortion? So Rubini, I'll start with you, and then I'll come to you.
Yes, so from the medications perspective, we've discussed that legally it's up to 9 weeks as a maximum. Most medical termination clinics in Victoria, usually it's like under 8 weeks generally, just because of the chance of bleeding with the medications can be a bit more, and the chance that things can get left behind when it's between 8 and 9 weeks. So that's for the medications perspective. For the surgical, it really is dependent on the centre that you're going to. So some places go up to 12 weeks, which is basically 3 months of pregnancy. Some places will go up to 15 weeks, and some will go further up to 20 or 22. So it really depends on the, usually once we get, past the 15, 16 week mark, sometimes we need to have consultation with 2 medical specialists to decide that this is going to be the best option for a pregnancy, because of the potential risks of the procedure, not being able to clear everything out 100% as well, risks of infection, and risks of potential injury during the surgical process as well. And the law generally is cutting off maximum in most states, but every state is a little bit different, so you can't really quote me on this. But 20 to 22 weeks is generally the absolute cutoff, because we generally have what we call viability in terms of the baby being able to be born alive and living after 23 and a half weeks generally. So, once we're getting close to that, it becomes very difficult for most potentially ethical for medical practitioners and also for the law to then say, well, this is like we're killing somebody, because that's when we're saying that, okay, if a baby was born in a hospital, we would be trying to make that baby live by resuscitating them. from about 23 and a half weeks generally in Australia. So, that's going to be, and that's already more than halfway through your pregnancy time. So if we talk about a 40-week pregnancy, generally, if we're talking more than 20 weeks, it means you've already done half your pregnancy. So generally, we would try to support women to make decisions much earlier. We do terminations much later than that if there's abnormalities with a baby. So for medical reasons, or if there's something that the baby's heart is not going to live with life, or we're not going to be able to do heart surgery on, or if there's some major life abnormality for that fetus and baby that's not going to be working for real life, then yes, we would do that further. And again, that usually involves lawyers and the medical ethics teams at hospitals and the doctors to decide what is okay. So I think, it is really generally a case-by-case basis once we get closer, like past sort of generally about 16 to 18 weeks. But usually most women have usually found out they're pregnant, or they know about the decision much earlier. So we're able to support them before that with the surgical means as well. Yeah,
I think
it's a bit hard. There's not one specific answer, but yeah.
From a psychological perspective, generally speaking, the longer you're pregnant, the harder it's going to be. You have more time to bond with the fetus, the baby. As they get bigger, they look more lifelike with the scans and all of that. You might be more obvious in terms of being pregnant to other people. Other people might find out about it. So it can get trickier the longer you wait. Whereas if it's fairly earlier on, then you haven't had that amount of time, which is not to say that it's any easier. You've just had less time being pregnant and having to wrestle with some of the decision making around whether or not to have an abortion. It is sort of worthwhile, regardless of what stage you're at, to still sort of reach out to make sure you're having the right information in place, to still sort of make sure that you're having that psychological support, because it can be something, the pregnancy hormones going through, even once you've had the abortion, after that, your body still then has to go through another transition to get used to not being pregnant anymore. It's a lot to sort of manage and get your head around. And a lot of women, express lots of intense emotions when all of this comes through. Some of it's hormones, some of it's just the journey that they've been on. So I think it's important to set up yourself well by getting these supports in place as early as you can, so that you know where they are and you can access them when you need them, rather than sort of leaving it right at the end, because then it might be a bit of a wait time before you can actually speak with someone. So just worthwhile considering that as well.
Absolutely.
Yes.
Before we
and
wrap
I think
up
just
this
really quickly also, when if you're having a scan done and you don't want to continue the pregnancy and you don't want to see the fetus or anything, just make sure you let the technicians or the doctors or everyone know. They usually will ask first to make sure, but sometimes people don't know that you want to terminate when you're having a normal scan. So you can say, oh, sorry, I'd not like to see the photos, or I don't want to see the video on the screen. Because then again, like Dr. Beulah said, it doesn't matter if it's early on or later on. Sometimes what you see or what you feel is different for everyone, even if it's 6 weeks pregnancy or 10 weeks pregnancy. But you might be able to see different things on the screen. So if you feel uncomfortable with that, please voice yourself and say, I don't want to see. And then again, and some people do want to see. Some people want to see what's happening to their body and what decision they're making. So on the flip side, again, we don't assume what you do want. So please just tell them, so that we respect what you'd like as well.
Absolutely. Well, this was a very important conversation, and I think we need to be having these conversations in regular periods of time. But before we wrap up, what would be your short one-liner message to our listeners, our viewers who are watching, any woman who might be needing this information? Beulah, I'll start with you.
That it's your choice. Even if it doesn't feel like it, even if you're told that it's not, it is your choice and it's your body. And there are people around, there are support services who will help you honor that choice.
Thank you. Short, sweet, but very, very relevant. Thanks, Beulah. Swaroopini, last words before we wrap up. What would be your message to our listeners?
I think exactly what Dr. Beulah said, and then also just seek help. So, just go and talk to a medical professional and ask them. And, you can just say, even if you don't know that, if you're decided, you can just say, you know what, I'm pregnant. I don't know what to do. Some people don't even know they're pregnant before we have to tell them, hey, you're pregnant. So, I think that's where, once you feel like something's changed with your period cycle, or your periods have stopped, or you feel that some change hormonally is happening to you, go and see a professional so we can figure out what's happening and help you together, whatever decision you want to make. And again, it's your choice. So we'll help you on your journey, no matter what the decision is.
Absolutely. Well, thank you so much to both of you who are voicing out such useful words of advice, and something that most women need to hear. And to all our listeners, those of you who watched Dr. Swaroopini and Dr. Beulah, I hope you've got a lot to take away, a lot to think about, the whole process around abortion, the whole concept around abortion, and how to take care of your mental health. As they all said, and I would like to second it as well, it's your choice. It's your body. You own it. You decide it. But then on that note, thank you so much. We'll call this a night, and I'll see you soon again, another episode of Chai Chat and Community. Till then, stay safe and a very good night, everyone. Thank you.